Unions are calling on the health department to seek alternative sources of energy. This after doctors and nurses at the Inkosi Albert Luthuli Hospital battled without electricity for 3 days following a burst transformer. It's alleged that repairs at the substation were stalled because of the ongoing municipal workers' strike. Unions say the generators are not enough to run the whole hospital as critical patients are being diverted to other hospitals.
We have been told that electricity has been restored here at Chief Albert Luthuli Hospital after going 3 days without electricity. Some patients had to be turned away because the clinics were not working because of the electricity, and operations at theatres were not able to operate. The blood service moved to King Edward, and some patients, critical patients, were also moved to other hospitals here in the area. What we hear is that the transformer in the area or that provides electricity to the hospital burst, and the municipality employees were unable to fix it because of the striking DSW workers. But with me now is Provincial Secretary of NEHAWU, Mr. Ayanda Zulu, will be telling us more about the situation here at the hospital. Mr. Zulu, we understand that it has been 3 days that the hospital has had no electricity, and some patients, especially those in the clinics, were turned away and were referred to other hospitals, and other services were also are sent to other hospitals like the blood bank. What is the situation currently?
Thank you very much. You will know that Inkosi Albert Luthuli is the largest hospital in the province of KwaZulu-Natal, and it also does academic work. You will know that if this hospital is affected, the entire health system in the province is affected. Even in some extent, the national health system is greatly affected. So for the past few days, our shop steward did brief us that there was no electricity. As a result, some of the functions, as we have indicated, they were shifted to other nearby hospitals, except those who want to perform dialysis as well as oncology. So we have been briefed in the morning by our shop steward that power has been restored, because the management did tell them that there was a technical fault as far as the transformer is concerned. So the technicians have been able to fix that. But we're extremely worried as the union. You know that the generator can only perform duties for limited number of hours. It does not have got capacity to run a number of days. So we do think that we need a plan B in situations like this. As I've indicated, that if Inkosi Albert Luthuli is affected, the entire provincial healthcare system is affected.
What happened to the patients that were referred to the hospital? Were they sent back to the hospitals or the places where they were referred to? What happened to those who were supposed to go to theatre? Were the operations able to go through, or were they halted?
What were briefed by our shop steward, that they were also transferred in nearby hospitals. Remember that some of the functions that are done here at Inkosi, some of them you can find them at King Edward, because King Edward is also a tertiary hospital, which means that there's a high level of specialists that are also situated there.
Thank you so much.
Thank you very much.
That was Provincial Secretary Mr. Ayanda Zulu telling us about the functions, the disturbance of functions here at the hospital, also confirming that some patients and some units were transferred to King Edward Hospital because of the power outages. He did say that there are generators here in the hospital, but they are not enough to service the whole hospital, but they are only able to service those critical units like the ICU, and only 4 of the theatres were able to operate or to function during this power outage.